Now let's talk about therapeutic communication. And you are going to be tested throughout the NCLEX on therapeutic communication. Um, they're so very important because they convey the nurse's respect and acceptance of the client, and also it encourages the client to express feelings and ideas. Now, the goals for therapeutic communication are that we understand both the verbal and the nonverbal message, that we facilitate the client's verbalization of feelings, that we communicate as the nurse acceptance and understanding of the client, and that we identify problems, goals, and objectives. Now, the very first thing that you have to do in order to communicate therapeutically is you have to be committed to the concept of active listening. Now, in most settings, most like a med-surg setting, for example, that means that we would be facing the client directly. Now, in the psychiatric setting, many times because of the issues going on with the client, to sit across from them and maintain this direct eye contact might be threatening. So in the psychiatric setting, perhaps you will be sitting side to side with the client, or you all will be sitting at a 90-degree angle, but you wouldn't be sitting across from each other. Be aware of your own body language. You need to have an open posture. I know for myself, for example, I like to sit with my arms folded like this because it's comfortable for me, but yet I'm conveying something negative to the client. You know, I'm conveying that I'm closed and I'm just really not interested in what they're saying. So be aware of your posture. Lean toward the client because you're conveying interest. Maintain intermittent contact. It doesn't have to be a direct gaze, but you know, you may look away and then you'll look back to the client. It's very important that you be relaxed. If you're tense, the person is going to pick up on it. Okay, let's talk about some specific therapeutic communication techniques. The first is, and I always find it kind of interesting, a communication technique, and it's silence. You have to be committed to sitting there quietly and allowing the client to take the lead. Sitting in silence allows the client time to think and also allows them to decide what they want to talk about. So you're going to sit quietly and wait. The second technique that you're going to use is you're going to use general leads and broad openings. The reason for this is you want them to direct the conversation. You're saying to them, I'm interested in what you have to say. So what you might say are, what are some of your concerns? Or tell me about your brothers and sisters. Something broad so that they can decide what they want to talk about. Another technique is called clarification. You will clarify the message. You're going to request feedback so that you clearly understand the message and that you are conveying to the client that you clearly understand the message. You clarify by using phrases such as, I'm not sure that I understand. In other words, you seem to be saying, or tell me more. The last therapeutic communication technique, which is very important, is reflection. You do want to reflect what the client is saying. And the reason that you reflect is it helps the client understand their own thoughts and feelings by sharing observations. You seem to be saying, or it sounds like you're feeling angry. Now, these are the therapeutic communication techniques, but on the test, you're also going to be asked to recognize non-therapeutic communication. So let's talk about non-therapeutic communication. Now, the reason it's considered non-therapeutic is because it is a block to effective communication. Either you've discouraged the client from expressing their feelings, or you're causing them to respond in a defensive way, and both of those are negatives. Now, the first non-therapeutic communication technique that you want to avoid is don't use close-ended or yes-no questions. The reason for this is it prevents sharing. For example, to say to the client, are you feeling better today? Yes? Okay, now where do we go with the conversation? But a more open-ended, how are you feeling? Then the client's able to discuss what they want to. Another non-therapeutic communication technique is don't give advice. Now, I read this a lot of times, and I always find it somewhat amusing because I feel like in nursing, I mean, we're always instructing the patient and we're always trying to help them, achieve whatever goals they're trying to achieve. But there's a therapeutic way to do it and a non-therapeutic way to do it. And if we are giving an advice, if we're telling a patient what they ought to be doing, in essence, what we're doing is we're communicating to them, you're not capable of making your own decision. So we're interfering with their ability to make a decision. So it's very important that we don't make statements like, maybe an adult child is talking about the difficulty that she's having coping with her father who lives with them, and the nurse says, well, I think it's time for your father to go into a dependent living facility. That's us giving advice. Another non-therapeutic communication technique is having a nurse-centered conversation. And sometimes these can sound empathetic. You have a patient that says, I think I had a panic attack yesterday. And the nurse responds, oh yeah, I had a panic attack last week and I thought I was going crazy. Well, now all of a sudden we're discussing the nurse. So remember, this is the patient's time and we want to be focused on the patient. The other problem with having these nurse-centered conversations is it makes us defensive. If we have a patient who says to you, I think you're too young to be taking care of me. Well, if we start defending ourselves, no, I'm not young. I may look young, but I've had 10 years of nursing experience. Nothing, there is nothing good is going to come from it. So maybe what we should do is turn around and say to the patient, well, you have concerns, about your care. So don't have nurse-centered conversations. And the last one is don't argue. And that almost goes without saying, but sometimes we can literally be sucked into an argument with a patient before we really realize it. And the problem with arguing with the patient is we're basically telling them their perceptions aren't valid, that they're just simply not right. For example, you might have a patient who says to you, I didn't get a wink of sleep last night. And as a nurse, you say, well, I came in here at 2 o'clock last night and you were snoring. Now, you may say, okay, I'm presenting reality. No, you're arguing with the client. So what you need to do is reflect the feeling tone. You feel that you're not rested this morning. So be really comfortable with the non-therapeutic communication techniques because they're going to be your wrong answers on the NCLEX exam. Okay, we have some more non-therapeutic communication techniques here. Another one is don't reassure the client. And again, some people say, well, what's wrong with reassuring the client? Well, what's wrong with it is you're underrating or undervaluing their feelings. If a client says, I'm really concerned about something that's happening next week, and you respond, oh, don't worry about it, everything's going to be fine. Well, I mean, here is this poor client, and, they've just said they're worried, and we've said, oh, forget about it. So you're not going to reassure the client. You're also not going to ask why questions. Why did you do that? Why did you make that decision? Because it implies criticism and disapproval, and it makes them be defensive, just as it would make all of us get defensive. So you want to focus on who, what, where, and when. The last one is don't give judgmental responses, because all that does is make the client feel guilty, angry, or not supported. For example, you're in the medical surgical area and you have a client who has type 2 diabetes, and you look at the results of their HB1C and you see that it's a 9. Now, in the previous 3 months, they haven't been real conscientious about following a diet or exercising. Well, you want to be real careful about how you start that conversation. You don't want to say, you haven't been following your diet, have you? Because then all it does is make the client be defensive. Okay, Okay, so that is the discussion about the non-therapeutic communication. Can't stress enough. You have to be able to recognize non-therapeutic communication in your responses when you're preparing for the NCLEX exam.